first of all, my name is Ubi3283 K. And this one is Marsha Camelia. This one is Rokamalina. And this one is Clarita and Alva. So I hope you guys can lend in your ears because we have some questions to ask.
Okay, before we start, I want to ask someone that has blue hair.
Yes, someone can have.
Do you know about HIV?
No, I don't.
Okay, I introduce about HIV. HIV is human immunodeficiency virus that attack and damage the immune system by targeting CD4 cells. It can lead to AIDS. AIDS is acute immunodeficiency syndrome. HIV also weakens the immune system by killing off CD4 cells. After that, this is the number of cases with drug inhalation. The graph that we can see here is decreasing from the other year before. So today, the data is 87,000 people. The percentage of Malaysia infected is 0.25%. And the latest new cases recorded, which is 2024, is 3,185. So the cases recorded by gender in total, female only 10% and male 90%.
So I'm going to talk about ways HIV can spread. So how does HIV can spread? Well, if not through hugs, shaking hands, high five, or sharing the toilet. Exactly though. So this is ways how HIV can spread. Firstly is unprotected sexual contact. It can transfer include vaginal, anal, or oral sex where the virus can be passed through the semen, vaginal fluids, and rectal fluids. Secondly is sharing needles or syringes, especially among the people who inject the drugs, can lead to HIV. This is because the virus can be passed through the blood-to-blood contact. Blood-to-blood contact is like giving HIV a red carpet to entrance into your body. Next is sharing personal items like razors or toothbrush can carry blood. So it seems with sharing needles, let's talk about blood-to-blood contact. Lastly is mother to child. Mother to baby, it can pass the HIV by the pregnancy, giving birth, and breastfeeding. So who's gonna be mom soon? Don't worry, because we can prevent it. So before we move to the next slide, I'm gonna ask a question. Just now I talked about ways to prevent. So how many ways I talked about? Why not? 4. So just now we talked about how it spreads. Let's look what it does. So common symptoms of HIV divided by 2, early stage and chronic HIV. So the symptom of early stage is fever, sore throat, swollen lymph nodes, rash, muscle and joint pain, flakish and fatigue, also mouth ulcer. Chronic HIV, there has no symptom, mostly lah, but it has swollen lymph nodes, fever, wet nose and fatigue. That's all from me. I pass it to the next presenter.
Okay, thank you, Kama. Hello, my name is Asa. I'm going to talk about impact of HIV to individual, family, and country. First, impact of HIV to individual is immune system weakening. HIV attacks will weaken the immune system, especially targeting our CD4 cells, which is our T cells, that are important for immune system function. As the number of T cells decrease, our body will become more vulnerable to infection and disease. Second is development of AIDS. As we all know, HIV can progress to AIDS if untreated. This condition can occur when body's immune system is severely compromised and the body becomes susceptible to infection and certain cancer. Other than that, health complication. People who are living with HIV are at higher risk of developing various complications such as tuberculosis, pneumonia, and nerve disorder. It can also lead to a chronic condition such as heart disease and kidney disease. Lastly is mental and emotional disorder. The diagnosis of HIV can cause significant psychological stress, including depression, anxiety, and feeling of isolation. Also, the stigma surrounding HIV can also make it harder for individuals to seek treatment and support from other people. Second, impact of HIV on family. First is economic impact, such as financial hardship due to increased expense. This is because the ongoing and expensive cost of medical treatment will burden family with low incomes. For example, antiretroviral therapy are treatment for HIV patients. Next is social and family structure disruption. For example, housing opens and role reversal. The death causing by HIV has causing many opens. The parents that dead. This situation disrupts family structure and can cause emotional and developmental issues for children without proper care and support from the parents. In addition, children may also be forced to take on adult responsibility, such as taking care of their siblings and working to earn some income. This situation can have long-term effect on their education, social development, and mental health. Lastly, impact of HIV on country, which is first is public health burden. HIV places a heavy burden on healthcare system, especially in poor countries. HIV also increase the cost of healthcare in countries as it require ongoing funding for HIV prevention, testing, treatment, and care. The ongoing cost of providing the art treatment also require long-term financial investment. Lastly, impact on education, which is can reduce school attendance. Children affected by HIV may miss their schools due to illness or caregiving responsibility or death to a parent. This can lead to a lower educational attainment and reduce opportunity for a bright future of the children. That's all for me about impact of HIV. For your information, there's a red ribbon here. Who know what it means? No. Anybody knows? This red ribbon is a symbol. It's a symbol. It's a symbol about war against AIDS and HIV. And this red symbol is chosen because of concern for the spread of HIV and AIDS. And why the color red is chosen? Because color red has a bond of blood and passion. That's all from me. I pass it to my next.
Thank you to the previous presenter. Now I will be sharing about the common myth and fact about HIV. There is still a lot of misunderstanding about how HIV works, and the misunderstanding can lead to fear, stigma, and discrimination. So there are six myths and facts that I put here. First one is many people believe that HIV is a death sentence, but actually with proper treatment, individual with HIV can live a normal lifespan just like anyone else. So if you're diagnosed with HIV, it does not mean that your life is over. Secondly, HIV can be transmitted through casual contact. This myth is totally wrong because HIV is not spread through casual contact. For example, hugging someone, shaking hands, sharing beds, or using the same toilet. HIV also does not spread through fluids like tears, sweat, or saliva, even insect bites. It only spread through some certain body fluids like blood, semen, vaginal fluids, and breast milk. It also can spread through unprotected sex and sharing needles. Other than that, there is also myth that individuals who have received treatment will not spread HIV. It is true that HIV treatment can help helps a lot. It because it reduces the virus in the body to the very low levels. But unless the virus is undetectable, the individual still has the potential to spread the virus, the HIV virus to others. So that's why regular checkup and safe practice are still important, even though you already have received the treatment. Other than that, many people also think that HIV positive mothers cannot have healthy baby. Actually, the HIV positive mother can give birth to HIV negative baby. The risk of mother to child transmission can be significantly reduced, almost zero, with the right steps during pregnancy and delivery. Next, it is if both partners have HIV, there is no reason for a condom. If someone with HIV takes the medication consistently and effectively, the level of the virus in the blood can be so low that it cannot be detected by regular lab tests. So that is what we call undetectable virus. And when the virus is undetectable, it also cannot be passed on to others through sexual contact. And that is what meant by untransmittable. But even both of the partners already have received the treatment, they might still carry other hidden strands of HIV that current tests don't pick up. So these strands can become a problem later, especially if the HIV strain is resistant to medication. So that's why protection and regular medical monitoring are still very important to avoid the risk of superinfection. Last but not least, many people also believe that HIV is only a concern for drug users and sex workers. This is a harmful stereotype because HIV can affect anyone, whether you are a student or just a regular worker. And it is important for us to take the precautions seriously to avoid this HIV virus. HIV virus also is not about who you are, but how you keep yourself safe, such as using protection during sex or not sharing needles. So it's essential to understand the risk and prevention method, not only for drug users and sex workers, but for all of us. That's all from me.
Thank you. So I will continue my part, which is the way to prevent the HIV. So first one is the PrEP, which is the pre-exposure prophylaxis, which is PrEP is a daily pill that we need to take before we affected with the HIV. So second one is the get tested regularly, which is we need to get a HIV checkup, like at least once a month. And the third one is the limit number of sexual partner, which is we can reduce the sexual partner lower your chances of being exposed to HIV, which is if we have a high number of the partner, we have a high risk to get the HIV. The last one, the ways to prevent HIV is to treat sexually transmitted infections is early. So the example of the speech is hepatitis B, C, and syphilis. So we need to treat the STIs first, and then we having an untreated STIs will increase the risk of getting HIV. Right, next. So this one is the data. Show the number of the HIV. The high we can see 31% is Selangor. Why? Because Selangor has a lot number of the people. Because the urban area and populated area will increase the number of the HIV. Next. This one is the table that shows you guys people living with HIV, new HIV infection and AIDS-related death. In 2022 until 2023 increase. For the people living with HIV, decreases. The new HIV is decreased and the AIDS-related also decrease. Why? Because of the technology. The technology now will decrease the amount of the HIV, people living in the HIV. So before we end in the conclusion, I have some questions, the same questions before, which is what are the meaning of the HIV? Who can answer? The first line is what the meaning of the HIV? Second question is why the ribbon is red color? So you guys not lend your ears properly. HIV is the human immunodeficiency virus. HIV stands for. So the red ribbon, what is the meaning of the red ribbon? Why we not put the blue or the white? Why red? Who ribbons, meaning the relationship between the blood and the patient. So the data show the high risk of the HIV is because the people living with HIV relate with more people in high risk because we have a lot of the ways why we need to prevent it. So I think the more advanced technology, we can reduce the amount of the HIV. So as you guys can see in this slide, we know that HIV is a serious virus. So we have the ways to prevent it. But we need to remember, not all the way is effective and not the way can we use. So at least we can prevent it early. You guys need to check early with the doctor. So learning how spread to protect yourself, we need to know that HIV is very important, whether we are students and with people with HIV can live longer. So most of them who are affected with HIV is not live longer. So that's why we need to prevent it earlier. So that's all from our group. Thank you.
Okay, so please write on another page for the water quality review. Okay. So another important thing is that if you go back the slide, the table, the comparison, I think the table of comparison. One more thing, the reference, show me the reference. So the reference is not following the APA system. You see, it does not follow the alphabetical order. It does not follow the alphabetical order, right? Ikut urutan kan. APA system, when I say APA system, it should follow A until Z. Okay? Not simply to be this one. Next, go up. Go up. Not this one, go up. It's the table of comparison. Yeah. This one, as you can see, I can see. But maybe for certain people, it would be very difficult for them to read. How many of you have been difficulty to read? Anybody? No one? All can go to Okay, so the selection of color is very important. Remember I said blue, right? And then the font size should be minimum 21. This is what is the font size? So please check. Next time when you do presentation, the color contrast need to be highlighted as well, right? So this is, it will be very difficult to read. Right? Okay, go up. Okay, and then like when you put too much of information, you see on one side, individual immune system weakening, development of AIDS, blah 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 blah. The font size is too big, and then it will be very difficult for people to get space. Did I ever say the minimum number of pages? Did I ever mention the number of slides? So you can go to check it. And there is no harm because the importance is that people would like to see and then you can deliver information correctly. Kalau cluster macam ni susah orang baca betul. Okay, ada table ni tak kisah lah. Because they are busy thinking about their presentation. So they don't bother tanya apa pun dia kata semua okay. But let's say in the future if you like to present to people in public or you like to share with somebody, so you kena memudahkan. Let's say saya punya slide macam ni, very cluttered. Will you be happy to see? Because one of your friends asked about the ribbon, right? Yes. Who asked Clarita? You asked about the ribbon? Who asked about the ribbon? Yeah, you asked about the ribbon, right?
Yes.
You see the ribbon itu ternampak. Ternampak because you can do so little space down there. You can always put the very big ribbon down there. Tak perlu pun letak gambar manusia tu. Kalau letak gambar manusia pun, gambar manusia tu, what we call it is like a water wash. Maksudnya tak terang sangat. Maksudnya di bagian background, so that people can see the body. Okay? Okay. So then